what I want to ask you is if you can elaborate briefly on how was your encounter with the disease? What was the diagnosis of your disease and the tribulations that you went in Canada, and how you and I came across?
Okay.
You know, if it's feasible. Though.
Sure, sure.
Oh, that used to be a marker.
When I was first diagnosed, it was a year ago this coming May, I went to my GP for my annual physical. He called me back in about 2 weeks to say my hemoglobin count was down. It was at 144, and he was a little concerned. He said, maybe there's something wrong with the blood test. So he said, come on back in. So I did. He phoned me back a week later, and he said it's down to 124. And he said, I'm going to send you to a specialist who deals with hemoglobin problems, which he did. And I went in to see him, and he took a look at me. He said, you're looking mighty healthy. I said, what's your problem? I said, well, my hemoglobin's down. He said, well, I'm not going to do anything today other than take some more blood work, which he did. And this would have been in early August, I guess. Bear in mind, we started in May. He called me back, and he said, your hemoglobin's dropped to 112, 110. He said, I want you to come in here. I want to do a bone biopsy, bone marrow biopsy. So on August the 26th, I remember that day very well because that's our wedding anniversary.
Oh my
And
God.
I went in and got my bone marrow biopsy, and he phoned me back within 5 days. He said, I want you to come in. So May went in with me. And that's when he told me I had myelodysplasia. And of course, I didn't have a clue what it was. I'd never heard of the word before. And so he explained to me that it was I guess just before you get acute leukemia. And he said, I'm going to send you to a specialist at the Sunnybrook Hospital, and who deals with myelodysplasia. So that appointment took a while to get, and I got in there in, I guess, mid-September, was it May? Something like that. And we visited with the doctor there, and she wanted to do more blood work. And again, my hemoglobin had dropped below 100. And she wanted to do a bone marrow biopsy as well, which she did. Then I said we had planned for some months that we're coming down here to Florida in early October. And she said, well, I think we'd better give you a blood transfusion because you're going to be gone for a few weeks. And we better do that first. So she arranged for a blood transfusion, 1 unit. And I had noticed there was a thumping in my ear. And when the hemoglobin drops, that's when the thumping starts. And I only notice it when it's quiet or at night when I'm trying to sleep.
Wow.
And so she gave me the blood transfusion. We came down here to Florida, and I guess we were here about almost a week, and May went to a health food store one evening. We drove up, saw it just up the road here on North Atlantic. And it was closed, but she picked up a brochure or two that they had outside. And we got back here to the apartment, and she was reading it, and she read about stem cells. And we knew of a lady back in Toronto who sold stem cells. It sounded like the same thing. But the gentleman's name was on the bottom of the literature. And May phoned him the next morning, and he said, sure, I can get you the stem cells. But he said, thinking about what your problem is, you should be seeing my doctor, Dr. Freitas. And he gave us Dr. Freitas' phone number. And we phoned him, and he was very kind. He came right over, I think it was on a Thursday, and did a full examination of me. And the next day we went over to the hospital for some blood work. And he said right away, you've got to get off the red meat and on a raw vegetable diet, and you get some beans, raw beans, and we'll start that. And he said, then I'll send you the protocol of what to follow in the medication. So we went back home and started the raw vegetable diet, which I got to tell you, I didn't enjoy one bit. And the raw beans I detest. However, I proceeded, as my family told me, it was either that or die. And so I proceeded. In the meantime, I had an appointment. I was referred because my doctor, no, I went back to Sunnybrook Hospital in Toronto, and the doctor there said, you're so close to having acute leukemia, I'm sending you down to the cancer hospital for treatment. And she suggested that we go right away. So that took another few weeks to get an appointment down there to see that doctor, and he wanted to do a bone marrow biopsy as well. So that was the third one I had in 3 months. And we went back, I guess a week later to get the results.
Are those painful?
Yes, they are.
They are?
They freeze, they take it from your hip, your back, and they freeze it, but you can still feel it. You can feel them digging
Oh.
and pulling it out, the marrow.
Oh.
Now, allow me to interject this. Realize how much time passed from the initial diagnosis
Yeah.
without therapy.
Yeah.
Test upon test and upon test,
Right.
and they already
Oh,
know
yeah.
what it is, and there's no therapy and no therapy and no deliverance, and the patient continues degrading, just like it happened with you. And then on top of that, they tell you radiation and chemotherapy will do it.
Right.
I'm sorry.
So we went back to the doctor at the cancer hospital, and he said, he looked at the results of the biopsy. He said, you don't have acute leukemia. It's myelodysplasia, definitely. And he said, I'm going to send you back to the other hospital
Oh my goodness.
for treatment there. So we went back, and the answer I got from the doctor there was, we have no cure. All we can do is put you on a clinical test, and she gave us 2 to choose from.
Give us.
And each one of them would be, there were so many side effects, and no guarantees of anything except death. And so she said, so we said, well, we'll think about it. Meanwhile, we knew that Dr. Freitas was providing the necessary protocol for us to follow here. And I said, May and I discussed it. We talked with our 2 sons, and we picked the option of going the naturopathic way with Dr. Freitas. And it wasn't easy, and I got to tell you, but I guess we started officially when you sent all the medication on November 22nd, and that was to go for 90 days, which it did. It was just raw vegetables, no white flour, no salt, no vinegar, no ketchup. I love ketchup on my food. It was very blah and very tasteless. And then we got into the isotopes, and I was drinking that, which wasn't bad. And then the next stage of the isotopes was spray it on your body. And I got to tell you, May, as Dr. Freitas has pointed out here earlier, she had to put up with a terrible patient. I was miserable because I'm not an easy guy to deal with. But we got through it because May insisted you got to do it. And spraying the isotopes on twice a day, once in the morning and once at night, was torture. I said, this is the torture chamber, and it resulted in, I broke out in hives and a rash all over the body, which itched like the dickens.
Really?
Can you imagine the amount of
And
pollution, toxin, intoxication,
Toxins.
breaking
Yeah,
right
coming
out
out.
of the skin?
Yeah.
Wow.
And
That's
so-
amazing.
So I covered my, Dr. Freitas said, put milk and magnesia on it, and that'll take the itch away,
Yes.
which it did.
Yeah.
My
Yeah.
famous milk.
Yeah.
Yeah, that's great stuff.